Hello, my name is Kari Carter-Cherelus. I'm a dental hygienist by trade. What I also do now is I work as a public speaker, a consultant, a coach, an author, and an instructor, as well as a professional educator for a company, and I do lunch and learn, so I'm pretty busy. I've been in dentistry for 21 years, 16 of those being a dental hygienist. So I start my day very early in the morning. I'm an early riser, so generally I'm up by 5 o'clock. Normally I would exercise in the morning, or if I'm not going to exercise, then I would write my book or attend to my Facebook groups or just really think about how I want my day to go. I find that by waking up early, that helps to really get me motivated to think about my day. Sometimes I even listen to motivational videos that I find on YouTube, especially when I'm exercising. I find that that really helps set my mind to have a positive aspect going into the day. So the day before, I usually set up for the patient. I like to have tray setups in my cubbies so that I can be prepared for the patient throughout the day. So before I leave the next morning, I like my room to be clean. I like everything to be stocked. I like goodie bags to be set up if we have goodie bags at that office. Everything is ready for the first patient. I like to know if the patient needs x-rays or if they have a certain medical history. So I also try to look the day before to see what needs to be done that particular day. I like to talk to my patients quite a bit. I think it's very important to develop a rapport with your patients and not just to constantly speak to them about clinical aspects or clinical needs. So I see how my patients are doing, what's been going on with them in their life as well. Are they safe? Since we've been going through the pandemic, one of my big questions was if they were safe, if their family was safe, if everything's been okay. I talk to my team members about everything too. I really like to talk, so I just communicate a lot with everyone, see how everyone is doing, what's been going on with them. If they need help throughout the day, I try to give them assistance and help. If there's a phone ringing and I'm available, I try to answer the phone, try to just help out whenever I can. So at the end of the day, I make sure that my room is clean. I set up the chair, I run the lines, I make sure that all my instruments have been sterilized. I try to help anyone else with their instruments. And then I also try to take a look at my schedule for the next day. If possible, I try to see at least my first patient and see what their needs are. Like I said, originally, I want to see if they need x-rays, if they need to maybe take pre-medication, or just update when the last time they had an examination so that I can know first thing in the morning what possibly needs to be done. My favorite thing about dentistry would probably be being able to help people. So although sometimes there's challenging patients and some days you may not have the best day, or it could be a lot to deal with dentistry, but what I like is that I'm able to connect with my patients and hopefully change their lives. And I like really being able to discuss with my patient treatment that the doctor and I see in their mouth so that they can get healthy again. And the thing about dentistry that I also like is that it's a lifelong learning process. So there's always something new coming up. There's new technologies, there's new communication skills to learn. There's just so much that the dental field is doing and expanding. So we can continue to learn and grow in these different ways. So even though sometimes dental hygienists may feel like all they can do is clinical, I basically have seen that there's so many dental hygienists who are doing their own businesses or becoming myofunctional therapists or speakers or giving continuing education courses or doing lasers or running their own businesses or mobile dentistry. But there's no limit to what we actually can do. So one thing that I've learned throughout my career is the importance of communicating with your team and your doctor. You really want to make sure that you get on the same page and that you guys can align with the doctor. Communication is so important. And so I talk to dental hygienists about the importance of communicating with different team members, not being afraid, making sure that they are doing the right thing for their team member. So sometimes dental hygienists, they don't have the correct instruments or the correct chair, and they end up having different problems with their hands or their back. And the doctor may not know this, so they really need to make sure that the doctor knows that they need different equipment So this can help protect the longevity of their career. And then it's also important that they talk to the doctor concerning different goals that they have. So if they would like the office maybe to do other things in the future, or they're taking some continuing education courses that they think could really help the office, then they should really try to have staff meetings or huddles, different things that are very important so that the office can grow. Advice to young hygienists who are just starting their career. Well, I actually have a book called The Ultimate Guide for Dental Hygienist Burnout. And so that book has a lot of different advice in there for new hygienists as well as veteran hygienists. It talks about interviewing, working interviewing, having boundaries, knowing ergonomics, and other options that they can have as far as their careers. So I really talk to hygienists about networking too. A lot of times when we come out of school, we're in a rush to get a job, and we don't always necessarily take time to make sure that the job aligns with our schedule or that we're gonna have work-life balance. So we wanna make sure that we work with that as well. One of the important things I feel is to make sure that they stay connected with the field. So going to dental conferences or dental hygiene conferences, not just taking all their CE courses online or through a book, but making sure that they get out there, they see the new tools, they see the new technology, they connect with other dental hygienists so that they can stay inspired. As a hygienist of 16 years, my experience with educating patients on their oral health is that you have to be consistent, you have to be caring, and you have to be reasonable. So, we always ask the patient if they're flossing, and more than likely, most of them aren't flossing. So we need to be able to give them other options. Then we want to talk to them about how they can use it properly. So we want to be reasonable with our patients, and we may recommend electric toothbrushes for them, and they may not be able to afford it. So we may want to recommend battery operated toothbrushes for them. We also want to make sure that we're recommending toothpaste for the patient's particular needs, as well as making sure they don't have an allergy to certain toothpastes, such as different prescription toothpastes that may have a chemical in there that the patient may be allergic to. So really we have to be educated ourselves on the different oral health needs of our patient in order to serve them better. And then we have to recognize that we have to be reasonable with our patients. Sometimes they have situations where they may be elderly, they may not be able to brush properly due to their hand dexterity, due to having arthritis, having Parkinson's disease, different things like that. So we may have to also educate their caregiver. And sometimes the caregiver feels overwhelmed and can get frustrated with that information too. So we just have to think about it that many patients don't have the dental IQ that we have. So we have to come at them lovingly and not just where they feel like they're getting badgered every time that they come to the dentist. What drew me to the career in dental hygiene was actually my mother. She always saw me walking around with a toothbrush when I was younger. I used to always brush my teeth with different things. Thankfully, everything was safe. So I would brush my teeth with baking soda to see how that worked, or Listerine, or hydrogen peroxide, or regular toothpaste. So I just wanted to see how that would work. And I think it was really some of the different toothpaste commercials with the cartoon characters that really motivated me to care so much about my oral health. And then my mom also, she knew that I was a talker. And so she thought it would be good for me to enter a healthcare field where I constantly talk to my patients. And she was right, because I do like to talk. And so I would say that she really was the one who inspired me to become a dental hygienist. So I'm Kari Carter-Cherelus. I'm a dental hero from West Palm Beach, Florida. And you can check my particular business, KMC Strategic Solutions, down below in this description. What I do now is I help others in the field, other dental hygienists, so that they can recover from being burnt out and stressed. And I also help the youth so that they can think about going into this field. So it was nice talking to you guys. Have a great day.